Good evening. My name is Paul Irwin, and I serve as Dean of the UAB School of Public Health. It is my pleasure to welcome you to the School of Public Health and to our special orientation event for the public's health. This event grew out of discussions with several students and alums about developing an event for all incoming students to introduce you to the school and to your classmates, and as a way to create a sense of community. An orientation event like this one is unique among schools and programs of public health. Our School of Public Health event was also inspired by the white coat induction ceremonies held in medical schools across the country for incoming medical students. We want our own public health induction ceremony to be clearly tied to the values to which we all aspire as public health professionals, whether in academia, practice, or other setting. Those values and the internal ethic of public health sets us apart from medical schools and other health professions. But in our planning and hopes for this ceremony, this thing called COVID has made its presence felt. But what a perfect time to actually come together and celebrate the communitarian nature of our discipline. The masking mandate is not about me, it's about me protecting you and you protecting me. So it is with physical distancing and all the protective measures that we have put in place. These measures reflect the values of public health, that what I do matters to the community in which I dwell, work, and play. If we had been able to have this ceremony in public, we would likely have had it where we've had it since the outset, at the Vulcan Museum, where the statue overlooks the city of Birmingham. When I was a medical student here many years ago, Vulcan's torch was a light. It usually shone green unless there was a traffic fatality that day in Birmingham, in which case it was red. That actually had a way of connecting residents across the city. We each bore some part of someone's loss. The connection today for me is the promise and hope of a magic city icon that serves as a welcoming beacon for all. We are all forged in ways that are both common and unique, but we comprise one community of public health. And tonight we celebrate this community in welcoming our newest members, our new students. We're joined this evening by our department chairs, associate deans, faculty, staff, and alumni. Without this community of scholars, there would be no School of Public Health and no inquiry into the health and well-being of our citizens. We are in their debt for the myriad of daily contributions they make. For the Public's Health is our opportunity to introduce you to public health as a part of this community of scholars and professionals dedicated to improving the health and well-being of everyone through research, education, and service. As a class, you're about to embark on a journey unlike any educational experience on this campus. Your classmates are the most diverse at UAB. You will have the opportunity to learn from each other as you explore the complexities of healthy people, from their genetics to their neighborhoods. Your classroom, real and virtual, will become a shared experience with fellow students who come from a broad range of social and cultural backgrounds that will enrich, inform, and guide your studies. You will have the opportunity to grapple with the most complex problems facing our communities, from those we live in to those across the planet. As I mentioned in the orientation session a couple of weeks ago, the COVID pandemic is all about the public's health. It is a time like no other, where you can immediately apply what you are learning in the classroom to the greatest public health crisis any of us has ever faced. It is now my honor to introduce our speaker this evening, Ms. Haley Green, a recent MPH graduate in epidemiology and currently a CDC Council of State and Territorial Epidemiologist Applied Epidemiology Fellow. Haley did her undergraduate degree at Middle Tennessee State University, and I actually had the chance to meet and work with Haley when we were both in Tennessee before we made our transitions to UAB. After Haley speaks, she will lead us in reciting the Declaration of Commitment to Public Health. The declaration was written by students in the school. It reflects a profound belief in and understanding of what public health, academic and professional, means to the health and well-being of everyone who shares this planet. Haley, thank you for being with us tonight.
I'll never forget running into you 2 years ago when you joined our UAB School of Public Health as Dean. It's been an incredible experience having you as our Dean, and you've been a wonderful leader for us all. I'm very excited to have the opportunity to speak with you all today as you embark on what I'm confident will be an exceptionally valuable set of experiences at the UAB School of Public Health. 2.5 years ago, I visited campus looking forward to finding a graduate school that best met my needs for education, practice, and community involvement. I was touched by the School of Public Health's motto to be somebody that strives to make a difference in their community and the lives of others. I saw the motto written all over the school, but even after it being explained to me, I had no idea the depth it carried until I finished the program. As a student, I was provided with the utmost support and resources in order to grow to become someone that is capable of making a difference against problems that adversely affect the health of communities throughout the state and across the globe. The opportunities for UAB School of Public Health students to improve the public's health are infinite and provide students with the possibility for hands-on learning through research, practice, and education. I know that, like many of you, I myself did not start out in the field of public health. I find that most people's public health origin stories all originate in a similar fashion. Typically, we are studying or working in another field where we realize the importance of public health. What I love most about our backgrounds is that they allow us to come together with new ideas and perspectives in order to holistically promote and protect the health of people in their communities. Our backgrounds help us understand the value of, for instance, addressing economic stability and social support when determining one's health. So with this in mind, I encourage you all to highlight your strengths as you seek to gain new knowledge. I know this isn't how many of you expected to begin your first semester as public health students. Many of you all have faced personal hardships this year. My heart goes out to each and every one of you as we are all still trying to navigate this new normal. I wholeheartedly applaud you all for where you are today. I can assure you that the faculty and staff at the School of Public Health will be understanding and accommodating during this trying time. I have never met such considerate and compassionate individuals who deeply care about your personal and professional development. Last spring, I completed an extremely hard semester as I devoted almost all of my time responding to COVID-19 at the state level while working as an intern at the Alabama Department of Public Health in the Infectious Diseases and Outbreaks Division. The faculty and staff handled the transition to the online format impressively, and I was thankful for the support that was provided to me by the staff within the dean's office. I know that it's a difficult time that we are living in, but if you work hard and pursue your passions, I feel confident that you will graduate and find a position in an area of interest like myself. Please know that the experience that you are gaining right now is significant. It will be fundamental to learn how to effectively collaborate with your classmates online, a skill that is now extremely important. So, I would like to share with you all a few pieces of advice that benefited me as a student. It will be extremely helpful to plan your time wisely in school. If you seek them out, you will find many opportunities. Therefore, it will be important for you to put in the necessary amount of time needed to produce fruitful work. You will have outstanding faculty and you will find a great mentor, but nothing will replace your hustle and your passion for public health that will grant you opportunities to set yourself apart from others. It is also important to understand that the opportunities I speak of are outside of school. It will be important to find the time to pursue these avenues of learning on top of your other personal and educational responsibilities. Thus, I encourage you all to take every opportunity you can to gain additional experience outside of the classroom. During my second visit to the school before I became a student, I met with faculty members who had published research in areas of my interest. One faculty member introduced me to Dr. Luis Padilla, an incredibly bright, talented, and fountain of public health knowledge. She quickly became my mentor, a great friend, and someone that I can look to for guidance still to this day. She truly embodies a role model in the field of public health. Over the past 2 years, I've watched her exude her contagious love for public health to her students, become a mother, and lead several research projects at once. She's impressive. This is just one example of many wonderful professors in the School of Public Health. Before I began my studies at UAB, I completed a Cancer Research and Experiences, otherwise known as CARES, internship during the summer of 2018 with Dr. Padilla, and later for a second time in summer of 2019. I had the opportunity to gain a variety of skills, including the introduction to SAS, a software predominantly used to analyze data in the field of public health. I then took the first and second semesters of my studies to become acquainted with the program and my professors. I highly recommend reaching out and meeting with your faculty advisor as soon as you have, if you have yet to do so already. It is integral to create lasting professional relationships with your professors, and your faculty advisor can serve as the first step to helping you achieve this. Following the spring of 2019, I completed an internship each semester of my studies. Yes, 4 internships total. I believe that not only did it provide me with fundamental experience, but it also allowed me the opportunity to understand what area of public health I really wanted to work in after graduating. I have been told that my internship experiences have truly set me apart from others during several interview processes because of the variety of skills I obtained while learning from others who have a bounty of knowledge to teach us public health students. I'm now working as a CSTE CDC Applied Epidemiology Fellow at the Virginia Department of Health. I'm primarily working on the foodborne disease epidemiology team, but I've also been assisting with COVID response and general communicable disease investigations for health districts in the Commonwealth of Virginia. So before I leave you all, I would like to remind everyone to please keep in mind how important your mental and social health are at this time. While utilizing a hybrid format and remaining predominantly indoors, I cannot stress the importance of assembling a social support system. I can attest to say that while you are in your program, you will have the opportunity to meet some of the greatest friends of your life, in addition to colleagues that you will collaborate with in the future. That is why it will be key to build upon these relationships with your classmates. So, in summary, my suggestions to you all are to prioritize your time, take advantage of all the opportunities you can to grow your knowledge while also gaining additional experience, and create professional bonds with your classmates, faculty, and staff at the School of Public Health. I wish you all the best of luck, and please do not hesitate to reach out and connect with me on LinkedIn. I'm confident that you all will be successful as UAB School of Public Health students, and I encourage you all to be somebody that strives to make a difference. Go Blazers. Now, we would like to invite the incoming students of the Master of Public Health program to join us in the reading of the Declaration of Commitment to Public Health. We, the incoming students of the UAB School of Public Health, holding sacred our duty to safeguard the health of our community, affirm our beliefs as we embark together on this important journey in our training. We will dedicate our time and talents to the preservation of public wellness through scholarship, education, and service. By declaring our beliefs, we affirm our commitment as students, as advocates, and as citizens to work in partnership with the women, men, and children of our community in order to protect the common health, the common rights, and the common good.
We believe that every member of our community is valuable. We believe that every member of our community should have access to health care, health education, and preventive services. We believe that as students of public health, we bear a duty to protect our community from suffering. And therefore, today, we begin the training necessary to provide that protection.
We believe that our efforts can only succeed if they are undertaken in partnership with those whom we endeavor to serve. We believe in innovation and embracing change. We believe in forging alliances and consensus. We believe that the scope of our efforts cannot be restricted by time or geography.
And we believe that the obligations to which we pledge ourselves today will endure long after we have finished our training. It is upon these beliefs that we undertake our education, understanding that we work not only to better ourselves, but for the betterment of the communities we serve. We are the students of the UAB School of Public Health.
Haley, thank you so much for your very wise counsel and remarks. And thanks to all of you for reciting the Declaration of Commitment to Public Health. I want to particularly thank our alumni who joined us for this. Again, Haley Green for MPH in Epidemiology, Helen Zai for MPH in Biostatistics, Nick Carlisle, his MPH in Health Behavior, and Angelina Aduke Zoluhi, our DRPH in Healthcare Organization and Policy. Thank you all for attending this special event where we are able to reflect on the meaning of public health as you begin your public health degree program. Typically, we distribute your School of Public Health pin, which I have here. We distribute this and a copy of the Declaration of Commitment to Public Health at this ceremony. And typically, I should say, if you wouldn't mind letting me pull back. Students sign the declaration for each class. And this declaration is then placed on the walls in the dean's office. We will make sure that within this year that you have the opportunity to stop by the School of Public Health at some point and sign this, and your school, your cohort's declaration will also have a place on the wall. But right now we'll be sending your pin, a copy of the declaration, and a school t-shirt to the mailing address that you provided in the coming weeks. We also want to encourage you to show off your pin and t-shirt, so be sure to take a selfie and post it on social media, tagging the School of Public Health. Tell us what you're most excited about in starting your career in public health. We'd love to see you representing the school at home. As we close, I want to express my appreciation to the School of Public Health staff who have planned and arranged tonight's induction ceremony: Maria White, Richard Bennett, and Chris Sima. Finally, I've been thinking about our collective efforts to combat, survive, and overcome the COVID pandemic as equivalent to a public health moonshot. In 1962, when announcing the goal of landing humans on the moon and returning them safely to the United States, President John F. Kennedy said, quote, "We choose to go to the moon in this decade and do the other things not because they are easy, but because they are hard. Because that goal will serve to organize and measure the best of our energies and skills. Because that challenge is one that we are willing to accept, one we are unwilling to postpone, and one which we intend to win," end quote. In the School of Public Health, we ask you to choose to matter. to be somebody, to make a difference, and become a part of this new moonshot. I look forward to traveling it with you. Thank you again for being with us tonight. I wish you good night for now and farewell.